Hi, I'm Dr. Rajani, and today we're back to jawlines. This is a question from you guys, so I'm answering it. The number one question I got recently was, what's the most important jawline injection point for beauty and to progress along a beautiful jawline? Because it does cost money to fill a jawline, and especially as people age and there's laxity of skin, there's a pre-jowl, and there's loose skin, and then accordion lines kind of go along with the jawline. So what's the most important injection point? And you guys all know, if you know me, I don't want to answer this. I think it's the whole face. It's the mid face, it's the upper face, and when you fill the upper face first, the jawline, there's less work to be done. But what is the most important injection point in the jawline? What do I use? And today, I'm going to give you a sneak peek at something I've been really enjoying doing with Sculptra along the jawline. As you may know, Sculptra is more of a collagen stimulator, so a lot of people were using strong structural products on the jawline and shying away from Sculptra. I've always liked some Sculptra because it tightens the skin, whether you add fillers and other biostimulators with it or not. It doesn't certainly have the G prime, but over time it tightens the skin, and the combination is part and parcel of it. So I'm going to dive into all of that, and yes, it's a Raji quick clip, so I don't have a lot of time. Let's get to the video. Okay, so the jawline. What's the most important injection point? Jawlines are a thing. Why? The movie stars have them. Successful people have them. Males have them. Females have them. So it crosses genders, and people are attuned to them. Not many famous movie stars, actors, actresses have a soft jawline. Often it's crisp. That bone structure is what keeps a face young. The high cheek and the strong jawline. You can have it genetically, the blessed, or you might have to create it. And now we have the ability to do so, and why not? We should, if we can. The problem is it costs a little bit of money. Why? A vial of filler is 1 ml. Imagine it can easily take 5 vials of filler, and if someone's near menopause, estrogen loss, a female of course, and there's loss of bone, that gonial angle, a little hint to where I'm going to talk about, is the area that I think is the number one injection point. Now, I'm going to go into it and I'm going to show you a sneak peek at the end of the video of something I'm loving. But first, in order to keep the videos going, to help me out, I'm asking you to click the like. When you click the like button, we go up in the YouTube algorithm. It helps me, so crush and smash the like button. Also subscribe, hit the subscribe and explode it. Perfect. And when you do, click the bell, and that will remind you, because I'm doing more community posts where you can see me live on Instagram and on YouTube and other platforms. And you know, if you're a provider, you want to learn, you're coming to conferences, you'll know where I'm at. So here you can see a good demonstration of what people coming in the clinic have in their mind of what they want to look like. This is the jawline that they're thinking of when they want beauty, when they are thinking, oh, I'm going to go get my filler and get my jawline. And that's why we're using strong structural supportive fillers. But today, of course, I'm going to show you that video of how to use Sculptra along the jawline in a certain fashion to create that. But this is the gonial angle, and this is one of the most important areas in order to get that jawline, the anterior projection. And of course, you know I love my parallel lines of beauty, and I have a whole video on the parallel lines of beauty, and that's where the cheekbone and the jawline in a 90-degree angle are parallel. So the jawline and the cheekbone have that parallel angle sloping downward, and that creates beauty as well. And then of course there's that gonial angle, but this is the area we're talking about. I'm going to show you an anatomical slide. Let's look at that. The gonial angle is probably the most important part, and you see me measured on people, and it's the angle of the jawline here. A male is going to be more upright, a female is going to be a little softer angle. And so you see me measuring it on my patients. Now, I might change it a little. A lot of times I'm going to keep it the way it is. Why am I measuring? People love to see it. You measure the angle of a jawline and your patient smiles and they're happy. It means you're paying attention. It means you know beauty. It means you're looking at faces. Sit in Vegas. Sit on your phone. Sit with your friends and watch the people go by and critique them, and in seconds go, what do you like about them? What don't you like? What's detracting from their beauty? We know beauty comes from within, but also there's a mathematical component, and our job as injectors, as aesthetic providers, are certainly to help maximize their inner self, but it's to let the outer self be congruent with the inner self and to work on the mathematical part, the symmetries, one of those being the jawline. So the gonial angle, when you inject it, it creates that angle along the jawline. Why I'm going to go to that, if I have to pick one as the most important point, is because when you volumize here, and often it's lost. You see in a female, especially over the age of 50, skin type, especially 2, 3, and a little bit 4, loss of bone, I want to use the word caves in here. There's a lot of osteoporosis or loss of calcium and bone at that gonial angle. When you volumize it, why I'm calling it the number one is it pulls back. Because you're volumizing here and it helps with the pre-gel. And you'll see me often inject the pre-gel, but if I can do most of my work from around the frame of the face, I'm not doing it in the window, it's not visible. If there's volume, if it's over volumized for a short period of time, it doesn't matter because you're over volumizing where people want it. You're not making them look funky by filling the window in here, oral commissure, in the pre-gel. So, the gonial angle, we measure it. It's going to be a larger angle if you consider like 110, 120, 130 for a female, more upright in a male, more like 90 degrees, 100 degrees. But there's crossover, of course. But people like to know the angle. You can inject it. Now here's a quick look at the anatomy. Again, it's not all encompassing, but for the home gamers out there who are trying to do this on their own, or when I say, hey, I'm going to show you a Sculptra technique that I like, it's the concept. Think about what you need to know to do it. I'm on the periosteum here with a micro cannula. Keep in mind, of course, you got the parotid lying above the masseter. You have the major vessels, which are deeper, but this is the one here that, if you think of the facial artery coming in that antegonial notch, it comes from the level of the bone and then moves superficial as it moves superior. But there's a lot of structures, and this is, of course, the facial nerve, cranial nerve 7. A lot of structures in the face that we're having to navigate specifically here with this technique is what we teach and what I teach how to avoid, because this is a large vessel, and the larger cannula, as we know, the better. But that's the complexity of it. Here's the gonial angle way back here, and when you see me inject the front, in the anterior portion, the pre-gel is in this region. You can see you have muscles, and watch my video also on chin injections for chin projections, an all-important part of the jawline, and you can see a case of necrosis in that video so you know what can happen. This doesn't demonstrate the vessels of the lower face, but gives you a very cursory introduction to when you're going to the clinic, what your injector's thinking when you walk in. They're not necessarily thinking of that beautiful picture we showed of a great, beautiful jawline. They're thinking of, wow, look at what I have to navigate to get there, and then meet the patient's expectations. Now, let's have a look at what I've been liking. I've always used Sculptra along the jawline, but we always reach towards our highest G prime filler, like a calcium filler. The Restylane family, I like Define. Some people will use Restylane Lift. And if you're using something along the Allergan's fillers, Voluma can work well. It's a little more expensive. Ultra Plus is a pretty good filler. But you don't want a lot of water drawn in this area. You want structure and support. So Sculptra builds your collagen. So two good go-tos would be something like Define, Sculptra, and then Restylane Lift for me. Those are classics. and they're going to create that structure. But Sculptra, when you put it in, of course, it doesn't have that robust structure of a filler. But what I've been doing a lot over the past year and a half to two is not just filling along the soft tissue, but actually using concentrated doses of Sculptra, large amounts, on the periosteum with first a bolus technique right at the gonial angle. Remember, whenever you're bolusing, that's your opportunity to pull back, make sure you're not in a vessel. And then I'm using typically a cannula along the bone. Keep in mind, you have a masseter, you have a muscle, don't inject Sculptra in the muscle, and also you have a facial artery coming up anterior to that masseter, so you want to be mindful of those. And I like a 22 gauge cannula. I never get any clogging with that, but I love that technique. So the gonial angle is the answer. A strong jawline is great for men and women. If you like these videos, click like, subscribe, join me on Instagram. Come on to an Instagram Live and join me there, ask questions, and join us at the many conferences around the world. Keep your skin and body beautiful, healthy, and vibrant.